Good morning. Thank you, Lene, and thank you all for joining us for this really important conversation about a critical lifeline that is really being pulled out from under far too many of our family, friends, and neighbors, taking effect December 31st. So again, we thank you for joining us and helping us really spread the news and make sure everyone understands the new Medi-Cal enrollment freeze that's impacted our immigrant communities. That's just 2 weeks away, effective December 31st, and important changes coming to Medi-Cal that are also on the horizon. Soon you'll have the opportunity to hear from leaders with LA County Department of Public Social Services, LA Care Health Plan, the California Immigrant Policy Center, and MLK Community Healthcare. And I want to thank all of them for taking some time out during this busy holiday season to sound the alarm for the December 31st deadline. Before I bring them up, let me start by saying a few key things. That from my perspective, as a local policymaker at the safety net level of government, at the county level, that healthcare is a fundamental human right. HR 1, also known as that big bill that was proposed and signed into law by the Trump administration, cut billions of dollars in federal Medicaid funds to California, which of course impacts Medi-Cal. Medi-Cal is California's version of Medicaid, offering free or low-cost health coverage to those who qualify. LA County, the largest county in the state and nation, has over 3 million Medi-Cal beneficiaries. The fear, confusion, and chaos caused by HR 1 and proposed public charge rules are intentional and mean-spirited from my perspective. So I think it's really important that we too are intentional about giving our residents clear and accurate information so they can make choices that are best for themselves and for their families. The choice to remain on Medi-Cal or enroll before the new enrollment freeze is a personal one. And I certainly understand the fear around sharing personal information with the federal government, especially given the ongoing raids on our immigrant communities and attacks on fundamental rights. These are deeply personal decisions that families must make based on their own circumstances and comfort level. But I want to make sure that they are informed choices and not just based on fear, which is what the federal administration is counting on. So we want to shed some light on what that actually looks like locally. For example, I have the privilege of representing LA County's 2nd District. I'm very proud to serve. The 2nd District is home to over 800,000 immigrant residents. Within that number, about 182,000 are Medi-Cal enrollees, again, undocumented. This is more than any other supervisorial district in the county. Many of our undocumented residents are part of families that include U.S. citizens and immigrants with mixed status who will feel these policy changes most acutely. The changes and rules that will be covered are complex. The purpose of today's conversation is to help raise awareness on the pressing December 31st deadline and Medi-Cal changes that are coming up in the new year, where residents and where residents can go to for accurate information and support. So you're going to hear us use terms like undocumented or satisfactory immigration status and qualified immigrant. Each one has its own specific definitions and its own exemptions. So we will have reliable experts here who will be able to help break down these terms so everyone understands how these new rules will impact them. So the main takeaway right now is this, very succinctly. Starting January 1st, undocumented adults ages 19 and older will no longer be able to enroll in full scope Medi-Cal. If you are undocumented adult, December 31st is the last day to enroll at Medi-Cal. Our immigrant communities, along with anyone, can enroll now at benefitscal.com. And just so we're all clear, when we're talking about full scope, it's everything outside of emergency room care or pregnancy care. Full scope covers regular doctor's visits, hospitalization, mental health, dental, vision, prescriptions, and substance abuse treatment. That's what we mean when we say full scope Medi-Cal. My office, in partnership with community organizations and healthcare providers, are here to share accurate information and help connect people to enrollment. While I'm in no position, unfortunately, to stop this hateful federal policy, we can continue to show up for each other with transparency, compassion, and support. That's what this moment requires from all of us, and that's why we've convened this press conference today. So I want to thank all of the members of the media for being here and helping spread the word on this important deadline and upcoming changes to Medi-Cal. Going to transition now to the real experts who are going to give you great, accurate information. I'm going to start with a member of my county family, Dr. Jackie Contreras, who leads our LA County Department of Public Social Services. DPSS works with the state on administering Medi-Cal here in LA County. And Dr. Contreras will be able to share more details on the changes to Medi-Cal that are coming and the DPSS resources that are available. Dr. Contreras, thank you for what you do for us every day, and I appreciate you joining us.
Thank you so much, Supervisor Mitchell. As Supervisor Mitchell indicated, DPSS offers a number of services. We offer cash assistance, food assistance, healthcare coverage, and help with in-home supportive care to over 4 million of our Los Angeles County residents. And today I'm going to reinforce a number of the messages that Supervisor Mitchell just covered. And I want to talk about two specific things that I think are very critical for people to be aware of. First, regarding Medi-Cal, which is our largest program that we administer. We serve over 3.3 million people through Medi-Cal. Right now, anyone in California that meets the income requirements can receive full healthcare coverage through Medi-Cal, regardless of immigration status. And at the end of December, that will change. So starting January 1st, 2026, and that's in just a few weeks, anyone applying for Medi-Cal that has unsatisfactory immigration status will be covered only for emergency services and services related to pregnancy. And so we are urging anyone who is not a citizen, who is thinking about applying for Medi-Cal, to do so before the end of the year, so your healthcare coverage is not limited. And this can be done in several ways. We have a number of access points. You can call us at our customer service center at 866-613-3777. You can apply through Benefits Cal, or you can come into any one of our offices located all across Los Angeles County. I also want to talk about what people can do to keep their benefits. It's more important now more than ever to make certain that all paperwork is up to date, that everything is submitted on time, and that changes are reported to us as soon as possible. Again, there are several ways to do that. If we can bring up the slide with the website, you can do that online via Benefits Cal, over the phone, by mail, or by visiting any one of our offices. And all our office locations can be found on our website. There are more changes occurring to both Medi-Cal and CalFresh that will happen later in 2026 and in 2027. These changes are primarily related to work requirements and new reporting requirements. You can find out more about these changes by going to our website, dpss.lacounty.gov, and clicking on the Keep Your Benefits button. Also, you can download a fact sheet, and you see the QR code here on screen that details all the changes to both programs. Finally, just to reiterate Supervisor Mitchell's message, given what is being reported at the federal level, I too want to acknowledge the fear in the community about applying for assistance at this time, about maintaining benefits, and also about concerns related to public charge. And make no mistake, we know these concerns are very real. While we encourage everyone who needs help to seek it out, and we want everyone who is currently receiving services to continue to do so, we also want county residents to have all the facts so everyone can make the best decision for themselves and their family. I'm personally extremely grateful for the benefits I received as a child and young adult, and want to ensure that we, DPSS, do everything possible to support all our neighbors in accessing benefits when needed. A los que nos escuchan hoy y hablan español, entrando el 2026, habrá cambios en los programas de CalFresh y Medi-Cal. Para más información, visita nuestro sitio web y haga clic en el botón Conserve sus beneficios. Gracias. Thank you.
Thank you so much, Dr. Contreras. To the press, we're going to hold Q&A to the end, but I just want to do one follow-up clarification with Dr. Contreras, because as I listen to you, I want to make sure I'm clear. December 31st is the deadline by which our undocumented family, friends, and neighbors can apply for full scope.
That's
But does
correct.
that mean that they are no longer eligible to receive full scope benefits after December 31st, or just apply?
So as long as they apply by December 31st, their applications will be processed and they are eligible to receive those full scope benefits. If it does not come in by December 31st, they will no longer be eligible as of January 1st.
Got it. So that's really important that we are pushing enrollment, but people should understand that they will still be able to continue to use the benefit after December 31st.
Correct.
Thank you very much for that clarification. I appreciate you. And it's appropriate. We're rolling right now directly into one of the largest Medi-Cal providers in LA County and its leader, Martha Santana-Chin, who's the CEO of LA Care Health Plan. LA Care Health Plan, again, is the largest public operated health plan in the county. And I'm honored to have you join us. Thank you so much.
Thank you, Supervisor Mitchell. And I'm very pleased to be here today as we work together to raise public awareness about the changes that are coming up to Medicaid, also known as Medi-Cal here in the state of California in 2026 and beyond. And, first of all, I'd like to thank Supervisor Holly Mitchell for her leadership and ongoing efforts to keep our county residents connected to the care they really need and frankly deserve. As the largest publicly operated health plan in the country, we serve 2.3 million Medi-Cal recipients here in the county of Los Angeles. And our mission is to make sure that we do our level best to deliver quality access to care to low-income communities and to support the safety net that serves them day in and day out. We want to do everything we possibly can to make sure we keep people covered and ensure that people continue to have access to benefits. And as Dr. Contreras noted, there are changes that are coming up. Supervisor Mitchell talked about the impacts of HR 1, so I will not repeat all of that, but needless to say that if you are on Medi-Cal today, it's really critically important that you do several things, including keep your information updated with the County Department of Social Services so that you're able to receive mail and information on anything that you might need to do to keep your benefits ongoing. And what's happening now is for those individuals that are undocumented and are not already covered by Medi-Cal, that December 31st deadline is critically important. Please consider applying before the deadline so that you have access to these benefits. Once January 1st comes around, if you're not already covered by Medi-Cal and you're an undocumented individual, you will no longer have the opportunity to apply going forward. If you have Medi-Cal today and you continue to meet income eligibility requirements and other requisites that are necessary to continue to maintain your benefits, you can keep those benefits. And I think that's a very important clarification. So again, it's really important that you consider applying before the 31st if you're not already covered. The freeze in enrollment will, in fact, prevent new individuals from accessing full scope Medi-Cal benefits. And we want to make sure that people are aware and have an opportunity to ask questions. So LA Care Health Plan will be hosting information sessions at our LA Care and Blue Shield Promise Community Resource Centers across the county. We have 14 sites. And those information sessions have already started. The first one we held was in our Wilmington Community Resource Center, but we would encourage anyone who is looking to learn more about the changes to take advantage of our information session. You can visit our website at lacare.org and find the schedule of information sessions. Now, having health coverage is often the difference between managing a condition and facing a crisis. So it really does help people afford to care for themselves, access diabetes medications, control their high blood pressure, and catch health issues early so that they don't turn into emergency and then later overwhelming bills. Without health coverage, manageable conditions can quickly become life-threatening. So again, we highly encourage everyone to apply. This is an opportunity for you to avoid unexpected medical debt. And we urge every Angelino to stay informed, be proactive, and respond to renewal notices. And like I said, maintain your contact information updated and reach out to trusted community organizations for help, including LA Care and many others. Again, your health, your stability, and your future is really important. And so we encourage you not to wait and to take advantage of the ability to apply in advance of the December 31st deadline.
Martha, thank you so much for that important information and for being such a critical partner in the healthcare delivery system. I hope you'll stay on in case the media has questions after. Martha mentioned LA Care being an important community partner, and we'll now hear from another one. There are countless advocacy organizations throughout LA County and the state of California that are ensuring residents have accurate information and are working tirelessly to hold the line for our immigrant communities. Here with the California Immigrant Policy Center is their Deputy Director, Shiu Ming-Cheer. Thanks for joining us.
Thank you so much for having me. So as mentioned, I work at the California Immigrant Policy Center, and we co-lead the Health for All Coalition, which works to remove immigration status as a barrier to the state's healthcare system. And we also work to ensure access to coverage and care for all immigrants in California. So we and our community partners have been deeply disappointed this year that when looking at the state level, our state leaders have adopted a budget that discriminates against some of our most vulnerable members of our immigrant communities, cutting access to healthcare by freezing Medi-Cal enrollment, reducing dental coverage, and proposing monthly premiums will make the program unaffordable for immigrant families who are already struggling with an increasing cost of living. The premium costs that will go into effect in the future can lead to future disenrollment in Medi-Cal, especially for larger households who have to pay premiums for multiple family members. So these cuts in premiums will result in immigrant families potentially losing Medi-Cal coverage and access to life-saving preventative care. So it's clear that in many instances, despite our significant contributions to the state's economy and social fabric, immigrant communities are the first to bear the brunt of the state's budget challenges as well as the federal government's attacks. And as other speakers have mentioned, this enrollment freeze is happening at the same time as we are seeing other challenges to getting people enrolled. First, immigrant communities are experiencing harms from the Trump administration's ongoing assaults and its ongoing mass deportation agenda. Immigration raids and indiscriminate arrests have caused many immigrant families to not want to go out for fear of being picked up by ICE. And many breadwinners are afraid of going to work, which is causing them even more financial hardship. Secondly, many immigrants have concerns about data privacy, given how the Centers for Medicaid and Medicare Services have shared personal information about 15 million Medi-Cal enrollees with the Department of Homeland Security. So in this environment, we're hearing from many of our health partners that people have approached providers about whether or not to enroll in or stay enrolled in Medi-Cal. So our message is the same as the other speakers. It's crucial that undocumented immigrants already on Medi-Cal maintain enrollment. If they disenroll, they won't be able to regain full benefits coverage due to the enrollment freeze in January. For people who are thinking about enrolling in Medi-Cal for the first time right now, we really encourage you to weigh the options carefully. The need for healthcare and medication can be balanced with the potential risks. The best way for somebody to make an informed decision is to first meet with the health provider. There's a lot of questions and confusion about the new rules. They're very complicated, and a trusted enrollment staff person can help to answer these questions. Many health groups and health providers have been providing workshops and one-on-one consultations in language, and having that language access and community trust has been crucial. Because of many concerns about going to in-person events at health clinics and hospitals due to fear of immigration enforcement, many of our community partners and health providers events have shifted online. After I finish speaking, I'll paste in the chat box some other resources that have been developed for community members to inform them about the changes to Medi-Cal, as well as the places where they can get local assistance. And then I'll wrap up by just saying that looking forward, my organization will continue to work with the county, with state elected officials, and with our partners to make sure that we continue to develop materials that are accurate and that together we can advocate for a county and a California that really protects the health of all of its residents. Thank you.
Shiu, thank you so much for joining us and for the work you do. I'm truly advocating at the front line for our residents here. So we've heard so far from the largest Medi-Cal health plan in the country. I correct myself. We've heard from the county. We've heard from a trusted community partner. We're going to transition now to hear the perspective on how these changes are showing up in the lives of patients in our hospitals. And to do that, we have Dr. Atul Nakhasi with MLK Community Healthcare. MLK is a hospital that serves the most people on Medi-Cal in LA County and is an undeniable asset in our regional healthcare network. Dr. Nakhasi, I know you were seeing a patient just moments ago. Thank you so much for carving out time to help inform the media, to help educate the general public. Dr. Nakhasi.
Thank you so much, Supervisor Mitchell. Appreciate the opportunity to be here. First, just speaking on very personal terms, as a son of immigrants myself, and noting the vital importance of our public programs. My spouse, my sister, and my brother have all depended on Medicaid at some point in their lives. And so it's a vital program, and my family knows that very personally, how important of a role it's played for my family and my siblings. But I can also speak in a very personal way as a physician for our community members here in South Los Angeles. I recall a mother in her 40s being one of my patients who we were able to enroll in Medi-Cal, but by the time we did, it was far too late for her end-stage diabetes. And I'll never forget because it was so heartbreaking. She came in completely blind because of her diabetes, her retinopathy, and that had been a complication causing her blindness from uncontrolled diabetes. And that was by the time we were able to enroll her, by the time we were able to get her access, by the time I was able to be her doctor. And what broke my heart most was her 10-year-old son had to be taught how to help support her, how to help her with her insulin injections, how to help her prick her finger so she could check her glucose and blood sugar numbers. And I thought, what world we live in that a 10-year-old child is taking care of his mother because she couldn't get access in time to the care she needed to prevent that complication. And that is the burden that falls on all of us when we don't provide the life-saving access our patients need. It falls on our family members, our children, our doctors and nurses in our clinics every day. But I also see the hope of the Medi-Cal program every day too. And I'll never forget just months ago, another mother in her 40s who came to our hospital here at MLK Community Hospital with severe fatigue and shortness of breath, and was admitted in the hospital and was found to have a mass in her colon. And it was diagnosed as stage 4 colorectal cancer that had already spread to her liver. And I was the first doctor to see her in her follow-up after she was discharged from our hospital. And I'll never forget the fear and anxiety and the uncertainty as I looked to her face in front of me and her daughter was in the room. And I was just thinking the precious time she may have left with her and her family members. But it was because of her medical access, I was able to get her to oncology services, was able to get her the chemotherapy she needed, was able to extend her life, whether it was days, weeks, months, or hopefully years that she may have left with her and her family members. So I know very personally how Medi-Cal serves as a lifeline for my patients and how devastating it is when they don't have that access to. And so I hope we can continue to encourage members to make those personal decisions with their family members to get the coverage they need and oftentimes serves as that lifeline and that they deserve as well. Thank you, Supervisor Mitchell.
Dr. Nakhasi, thank you, particularly for giving us those real life stories. And I hope the media will take those and run with them It's for stories just like that, real life stories that helped form my policy perspective, my core value that I do believe that healthcare is a basic human right. That when there are preventable chronic health conditions that can indeed be prevented, treated, managed, and people don't have access to doctors like yourself, hospitals like Martin Luther King Community Hospital, we are denying people basic human rights. So thank you so much for sharing those stories. At this point, we'd like to open it up to the media who've joined us. We've got quite a few. Thank you so much. I believe we can, you can either raise your hand, put your question in chat, and Lene is going to help us manage it. We've got all the speakers on the screen, so you know if there's a particular person you'd like to direct your question to. Lene, I'll kick it over to you.
Yes, if there's anyone that would like to ask a question, please raise your hand and we'll call your name. And we just ask that you share your media outlet. Okay, no hands raised.
Okay, I saw KABC, KTLA, Fox News, several print publications. I'm sorry.
There's a question in the chat, Supervisor. Is this for if this is for the county official, why push for the county? This is for you, Supervisor Mitchell. If people are afraid, why are we pushing for people to still sign up for Medi-Cal? What do you tell people who are afraid? What do you tell people?
Yes, right. So again, the point of really making sure that people get accurate information, and they have to make the decision that's best for them. I don't want them to be afraid based on hearing news about those who are trying to take the benefit away. If I were one of the women Dr. Nakhasi told us about that had a chronic health condition that could devastate my family financially, I would have to weigh the potential risk of enrolling with the services my family and I need today. I think we heard from the Immigrant Policy Center, again, it's so complicated. Medi-Cal policy is so complicated. All the rules that govern how you enroll, how you maintain your enrollment through redetermination, it's complex. We just want people to have information and not simply decide based on the fear of potential public charge to not enroll, particularly if you have a current medical condition that needs to be treated so you don't end up in late stage cancer and all those examples Dr. Nakhasi gave us. So these are difficult decisions people are having to make. The point of today is to share information with residents. I don't want people to not enroll based on limited information and based on the fear tactics that we are receiving from the federal administration. Anybody else like to comment?
We have Pamela Anching with the Immigrant Magazine. Pamela?
Yeah, thank you so much. This is a very vital briefing. I just have a question about after December 31st, because I know today is already past the middle of the month. So I'm wondering if there's a way that that the county can track those who will be left out or who are still considering if it's worth it. Because even now, even legal immigrants are scared, or everybody's being targeted. So I'm just wondering if there's any way that we can really, really convince them to enroll, and if not, what other measures will the county be doing? Are there other opportunities for them to still be able to get care?
So I appreciate that question, Pamela, and that's the tough question. The county is the safety net level of government, and before California took advantage of the opportunity to expand Medi-Cal, before there was a covered California program, we had huge numbers of what we called medically indigent adults, people who had no coverage, who showed up at emergency rooms. And the whole point of expanding Medi-Cal, the whole point of covered California was to move away from that and to give people coverage as appropriate. I served in the legislature for 10 years and was very proud of the work the legislature and this governor and the previous administration did at the state level to expand access to Medi-Cal. And so what we're experiencing is a retraction of that, starting with actions taken by the federal government. Actions taken by the federal government that aren't based on a recession or lack of resources. These are political decisions, choices that have been made to not provide health coverage to a certain segment of our population. It's really important that we understand this isn't fueled by a lack of resources. I lived through the Great Recession in the state legislature, where we experienced horrible cuts to Medi-Cal because we didn't have the resources. The federal government has chosen to cut $1 trillion out of Medicaid and instead give tax breaks to a certain population, right? So the best we can do is share information and encourage people to take the best action possible for them, as you've heard us state over and over again. And the problem is with the elimination of that $1 trillion from Medicaid, the state's coffers have been impacted, so have the county. And so the real fear is, do we go back to those days of a medically indigent adult where federally qualified clinics and the county health system also is not going to have the resources to provide services, which will be emergency services and won't be prevention care like you can get through full scope Medi-Cal. So these are, from my perspective, dangerous policy decisions that are being levied upon us by the federal government that are going to put counties across this country in peril in our ability to provide services to our residents. Can the county backfill the billions of dollars that are being lost in the Medi-Cal program at the state and county level? No, we cannot. Those dollars roll. Medicaid dollars come from the feds to the state to the county through the Medi-Cal program, and the county's not going to be in a position to backfill those resources. So encouraging people to enroll now, as we understood, the enrollment deadline is December 31st. You can continue to receive full scope Medi-Cal after December 31st. And again, people are going to have to make the very tough personal decision about if it's worth it to them or not. I want people to have the information to make sure that they are making an informed decision. Any panelists, please feel free to speak up.
Thank you, Supervisor Mitchell. I do want to jump in here because I in no way want to minimize the fear. I think all of us have made that clear. We understand that it is very real. And when it comes to public benefits and somebody who received them as a child, many strategies have been employed to keep people off of public benefits, even though many of them are entitlements. So we shame people to not get on public benefits. We make the programs exceedingly complex to make it difficult just to be able to understand what they need to do to apply and to stay on. And now we're seeing this environment of fear. And so I think it's really critical that if those things were to drive, right, people would not access the benefits that they need.
Yeah, and I just wanted to add one thing too, which is, looking into January and beyond, it feels as though nearly every day the rules are changing. There's something that comes up in the news that affects immigrants. So, one thing I would suggest looking into New Year's for people to continue to monitor the social media accounts and websites of trusted organizations and public officials to be able to get news about whether any of these rules are changing. And then, we always recommend that people who are not citizens, speak to an immigration attorney. And in this context, I think that also applies because the type of temporary status or protection a person has or what they might be eligible for under immigration law will also affect their eligibility for Medi-Cal. So I think getting that screening on the immigration side can also help to inform the decisions that people should be making about whether to apply for public benefits in Medi-Cal.
And
Thank you for that.
I would just add, just to build on all these comments, two aspects. One, the fear is so real. I was just with a patient a few months ago over this summer, and she'd asked me, she said, "Dr. Nakhasi, can you please sign this medical note so I can bring my dog with me on my travels?" And I asked her where she was going, and she was leaving LA County for Oregon because of the targeted immigration enforcement actions. And I thought, how sad, she's been my patient for 7 years.
Mm.
In my clinic, I've been caring for her, providing the best possible care. And because of the fear, it's having a real impact on people's lives, um, to the point they're leaving the area and then they're losing their doctors. I lost my patient because of that. Someone I was fighting for, protecting their health for years and years and years. So that's real. And we saw it at the hospital, at MLK Community Hospital. We saw significant declines this summer in May, June, and July in our ED volume that we track daily, due to the fears of individuals coming in. But my second message is more hopeful, which is we will be open. And no matter who you are, no matter your coverage, no matter your documentation status, no matter your ability to pay, we will be open for you. Our emergency department is open 24/7, and we will be there to care for you. And so please, when you need us, we are there for you. These are very personal decisions about coverage to be made between family members and their providers. But when you need us, our emergency department is open, and we serve the highest number of Medicaid ED volume in the state of California with 84,000 Medicaid ED visits a year. So I just want to also offer that message that the doors will be open, they will stay open, and we will be there for you when you need us.
Thank you so much. I want to address the first section of that question. Why this push from the county? As Dr. Nakhasi said, and others, so many of the rules are changing, and it's Dr. Contreras' Department of Public Social Services, that are responsible for administering the program. And so the push from the county is to make sure that everybody understands the rules as we understand them today. There are some, we keep saying there will be more changes on the horizon in the new year. We know that the State Department is still trying to understand what the federal government is declaring, to give counties guidance on the rules for administering these programs. So the push from the county is because we're directly impacted in that we administer the program. So we're trying to understand all the new rules and regulations that are coming out of these policy changes, as a result of HR 1 and other policy changes from the state legislature and the state administration as well. Any other questions?
Yes, we have a Pamela Enchin with Immigrant Magazine with a follow-up question.
Yeah, thank you so much, Dr. Nakhasi. I think my question is for you or anybody else I can answer. When we talk about emergency care, what are we, for example, what kinds of emergency care are we talking about? Because now if they can't enroll if they don't enroll and they miss, what can take someone to the emergency room and that they can get care?
Thank you, Pamela. If you walk through our doors, we will see you, and it can be for anything.
Okay.
Now, in the ideal world, you would have access to Medi-Cal and you could see me in the clinic, right, for those preventable conditions, so that, God forbid, we wouldn't have to diagnose your stage 4 colon cancer in the hospital because I was able to screen for it years in advance. Or God forbid you had the end stage diabetes and had blindness, because we were able to screen for your hemoglobin A1C years in advance and manage your diabetes. But we have patients, unfortunately, because access has been so hard in so many ways for them, who show up just needing prescription refills of their insulin to our emergency room. So that's the answer to your question is we will be there for you, that we are the safety net of last resort. Patients come to us for everything that they may need. And hopefully we can provide that care in settings that are more preventable and in community-based settings. But the reality is, under today's circumstances, if you need us, we're there for you. So again, if you show up to the emergency room, you will receive guaranteed care from us. There's federal law, EMTALA, that supports that for emergency departments across the county.
One thing I would like to add.
Yes.
Yeah.
Go ahead, Martha.
Yeah, thank you. One thing that I would like to add on that is, going back to the question about why is it important for people to apply before December 31st? I think Shiu Ming made a really good point earlier that I want to underscore, and that is things are changing on a regular basis. Based on what we know today, the policy decision still stands that you can qualify for Medi-Cal regardless of immigration status, so long as you meet the income requirements. And the decision that has to be made is in fact, very personal. I think there's a lot of resources out there that you can access to learn more about the trade-offs. And the work that Dr. Nakhasi and MLK do is really critically important for all of the communities that we serve. The one challenge through all of this is that today there is funding available through the state-only Medi-Cal program. There is funding through Medi-Cal in general for legal residents that fully qualify for Medi-Cal that is federally funded. The more that we take advantage of the resources, the more that physicians like Dr. Nakhasi and many others who dedicate themselves to serving our low-income communities can continue to support. And so these are very personal trade-off decisions for individuals to make because we all recognize that there are risks. The other reality of all of this is that the more that we are able to pull down funding to support the work, the more people we are able to serve, and the more providers are able to sustain their ability to continue to provide services. And so it's a very complicated dynamic that we're having to work with and work through. And in an ideal world, I think Dr. Nakhasi nailed it. We prevent that emergency. We address preventative health needs early on. We access care with primary care physicians. We make sure that people and their children get vaccinated, get the flu shot, get their preventative screenings, prevent, the crisis care that could happen that leads to the interventions that are necessary in an emergency department. So that's the other side of this and why it's important for people to recognize that there are programs out there that can provide benefits to you to avoid all this crisis care. And it also helps the delivery system so that we can help support their work to have more services provided to more people. So it's complicated, but that's also a very important part of the discussion.
Martha, and I would just add just very briefly to that, 100% accurate, and I appreciate that perspective. We will be open for whoever enters our doors, but it puts tremendous financial strain when there's uncompensated care, which is why the Medi-Cal program is so important because it supports safety net providers like MLK Community Hospital. And I'll just give a very concrete example. We provided more than $14 million in charity care for individuals who needed us, who came through our doors. And so if we can help support our hospitals through the Medi-Cal program and our providers, that makes all the difference because as Martha said, then we can use those resources to see more patients and provide the best quality care possible and do so in community-based settings as well.
Beautiful. Thank you for that. I would just add my practical, non-medical perspective. Pamela, by the time you decide to go to the emergency room, you are in pain. And emergency rooms and emergency departments are not the places where preventive services are offered. And so those days, years ago, that I don't want to return to with so many medically indigent adults in LA County, people got care in the emergency departments, care that they ignored for far too long because they didn't have access to preventive services. They didn't have an established relationship with a doctor. They got their services in emergency rooms. And that's not the kind of system that sustains health and prevents disease. It just isn't. Other questions? Thank you, Shiu, for adding all those resources to the chat. I hope everybody is able to see them and access that important information. Lene, do you see any additional questions?
I do not, Supervisor, and I want to reiterate that we are going to share all the resources that were provided and a recording of this conversation with everyone as well.
To Martha, Shiu, Dr. Contreras, Dr. Nakhasi, thank you so much. For the work you do each and every day. Please know that I see you, we see you, and I value your commitment. Secondly, thank you to our partners in the media. We need you as true partners to share this information, to make sure people access these resources, to help them make really important life-saving decisions for themselves in a short period of time, with December 31st right around the corner. We also want to make sure that you continue to be our partner, because we will have to probably convene this group again into the new year to talk about the additional potential changes that will be coming down from both the federal government and the state government, impacting California's Medi-Cal program and the impact it will have on LA County's 10 million residents. I wish you all a safe and happy and productive holiday season and new year. Thank you so much for joining us today. Peace be with you.